Hey, everybody. Welcome back from the lunch break. Hopefully you've been listening in on our SEO panel with Amber. We've also got a concurrent session running with our partners at Fresh Paint. But today we are here with a really awesome panel of women and quite a diverse set of backgrounds in the dermatology and aesthetics field. I am going to let them introduce themselves. Let's go ahead and start with Ashley. Ashley is the marketing director at VitalSkin Dermatology. And Ashley, I think across all the categories we're going to cover today, VitalSkin is kind of in the middle in that you guys offer both medical derm and aesthetics and cosmetic derm. So I'd love for you to just give a little bit about your background, your role, and then we'll introduce our other panelists.
Sounds great. Well, first, thanks for having me. It's a pleasure to be here and talk today. A little bit about myself. I've been in the specialty healthcare marketing space for a little over 15 years now. Started in the dental service organization, working there in mostly marketing, but also covered provider recruitment, internal comms, and a few other odds and ends as marketing sometimes covers. After that opportunity, had the chance to join VitalSkin. And VitalSkin is a startup organization. We're just in year 3. We've been with Cardinal since our inception. They stood up our first site in a rural location in Illinois, but have been working with them since. So we cover all things patient acquisition, patient retention, internal comms, huge partners with our operations team. We have an operational excellence committee that our team sets on as well, and then handle provider recruitment.
Awesome. Thanks, Ashley. And you and I have done events before, so it's great to have you back. You guys have been great partners. We'll dive in a little bit more on VitalSkin in a few minutes. Jeanne, it's so great to have you on the panel. US Dermatology Partners really focusing in on the medical derm side of things. So we'll make sure to speak to that specifically. But if you wouldn't mind, give everybody a little bit of background on yourself.
Sure. My name is Jeanne Cunningham. I work for US Dermatology Partners. I've been there for about 9 years. I've pretty much straight out of college, I've always been on the healthcare marketing side or physician recruitment. So Ashley and I have some things in common. I wear a lot of hats at US Dermatology Partners and oversee all things marketing, be it digital, SEO, PR, reputation management, e-commerce, and then also physician and provider recruiting and ramping. We do some cosmetics, but we're not heavily focused on cosmetics. So we have a tendency to lead with medical and then work on nurturing those relationships for patients that want cosmetics. And I look forward to the chat.
And if that isn't the theme of this entire 2-day session, marketers wear many hats. Maybe that's what we'll call it next year, because that has been what everybody says. You guys, there's just so much we have to do, right? And we're trying to figure out how to do it all. And lastly, I want to introduce you guys to Stacy. Stacy is with Inspire Aesthetics, an MSO managing multiple brands in the aesthetics and plastics vertical. So Stacy, let everybody know a little bit about yourself.
Thanks, Lauren. It's really nice to be here and to hopefully learn from Ashley and Jeanne as well in this session. But as you said, Lauren, I'm Stacy Harrison. I'm the VP of Marketing for Inspire Aesthetics Group. We are a platform and network of plastic surgery centers and med spas across the country, mostly focused in the Southeast. Prior to joining Inspire Aesthetics, I actually ran my own brand marketing agency for healthcare companies. Prior to that, I was the director of creative for a national chain of spine surgery centers called Laser Spine Institute. And that's really where I got my start in healthcare. But I have about 20 years of marketing experience. Prior, I was in more of an industrial role with construction equipment and a much different field than we're in now, but it's been really exciting to get to know the aesthetic space. And what I've really discovered, it's about building relationships with our patients. And so hopefully that's what we could talk about today, as well as how to influence growth through relationships.
Absolutely. We're going to get into all of that. I think I always like to start these with, because I think it helps us, orient where you guys are all at in your marketing journey. And it helps our listeners kind of relate, to what you guys are going through. Biggest challenge that you have faced in whether it's the medical derm or aesthetic side, what is the biggest challenge you have right now as a marketer or CMO of your company? And I'll start with you, Ashley.
I think on the twofold, right? Since we do medical and cosmetic. On the medical side, definitely within the COVID era still, I think we're still recovering from patients kind of coming back into the office, getting into those annual skin checks and really realizing the importance of that. But the flip side of that, I think from a derm standpoint, is not all patients realize that you can self-refer to dermatology. You do not need a primary care provider to refer you. So we do a lot of education around just letting patients know that they could be the advocate for their health choices, their health care, and then utilizing the insurance coverages. I don't know with Stacy and Jeannie where they're at, but Illinois insurance coverage actually covers an annual skin exam. So making sure that you're seeing that patient one time a year, making sure they realize it's covered by insurance, and then optimizing the time with that patient when they're there to make sure that we're covering all other skin concerns, all those things that they waited so long to talk to a provider about, and now they're face to face and get a chance to do that. On the
Yeah, and
cosmetics, oh, go ahead.
I was just gonna say, you probably get like with the COVID, kind of backlog, you probably have so much anxiety too, as a patient of like, I've put this off. I'm,
Right.
now, and then you're like, do I want to do it? What am I going to find out? Would I rather not know? So I know there's like, maybe a little bit of stigma and also anxiety around, filling that gap.
Absolutely. Absolutely. And then on the cosmetic side, just competition in general. For us, it's definitely med spas. We are a gen derm led practice, physician led. All of our treatments and everything are done by licensed providers. And having the med spas kind of on like every corner is definitely a challenge for us. It's a challenge on just kind of scope of services that they offer, and then pricing. I mean, that's really what it comes down to it from a consumer standpoint, once they have the ability to do all the research that is at their fingertips.
Yeah. And it's all there. We know that like 80+% of those journeys are starting online. So they have every bit of information. It's just kind of navigating that. Jeannie, what do you see in like the more, primarily medical derm side has been your biggest challenge this year?
I think I'll echo what Ashley said, that a lot of patients, some of it is education on trying to help people understand the importance of dermatology, that it is, I think a lot of times when people think of dermatology, they think of Botox. They don't understand, dermatology is a cross section. The skin is your biggest organ. So a lot of medical conditions actually come out through your skin. So dermatologists are very bright. It's one of the most competitive programs to get into. So they can really coordinate a lot of that care. And it's important for patients to be seen annually to stay ahead of those things. From a challenge perspective, I would say, really probably it's like this 2 long year threat of getting rid of third-party data. We forced us to move toward CDP. So we've spent a lot of time on that, building that out this year. So I think that, and then of course the Google Analytics, we moved to GA4, removed GA4, remove all the pixels. I mean, it's just been kind of a little bit
hard to stitch it all together.
fast,
You're like, I have 27 sources.
Yeah.
Yeah.
So it's
Jeannie,
been a
just
little wild. Yeah.
Curious, what CDP did you guys deploy, and tell me a little bit about that deployment? I know that can be like a huge, there's a lot of like fear around going into something like that, and it's nice to hear from someone who's been through it.
Yes, it's Salesforce is the one that we chose. And I think we bit off a little bit more than we realized. So we did CDP, Datarama, Interaction Studio. We'd already been using Salesforce for Marketing Cloud for so doing those journeys, patient journeys. And I wouldn't say that, I mean, we're up and running, but we took a little bit of a hit with removing some of the stuff with Google and Facebook. So we're leveraging Mixpanel, and then we can still see the visualization of on Datarama of our cost per booking, cost per lead, and revenue. But then we're trying to build out all of the it's like mad science, building out the journeys and the cross-selling. So it's been a lot of fun. But it's definitely a heavy lift.
Yeah. And there's in the deployment of something like that, there's never like I started it and I finished it, right? There's no finish, point. It's always ongoing.
That is exactly right.
Yeah.
Really
Well, Good, good. We're going to talk more about technology because everybody, loves to know what everybody else is using and get some recommendations. But Stacy, would love to hear a little bit about what your biggest challenge is. And I know you, because you and I know each other well, you're building the plane while it's flying. You're trying to set the foundation and taking in acquisitions at the same time. And how are you navigating all of that? What are you up against?
Yeah, I think that's obviously always a challenge, is supporting the partners that we have while making sure that we're focused also on, acquiring new ones. This year has been a particular challenge. We came out of the pandemic with elective procedures really strong. People are just sort of waiting to get their Botox and their surgery that they have maybe put off for some time. So 21 and 22 were amazing. 23, not so much. It's a year of challenges, because I think people are just still a little concerned about where they want to spend their money and whether they want to spend it on elective procedures. And then from a patient acquisition standpoint, just truly seeing that attribution in the midst of all of these different issues with HIPAA compliance. So I'm kind of in the same boat there as Jeannie, where we're standing up the right technology to make sure we're protecting PHI, and also still allowing our marketing partners to be able to see as much data as they can. That has proven to be challenging, and we're kind of right in the beginning stages of that. So it's been a really fun journey, learning a lot, but also just like you said, it's a never ending journey. It's continuous. So definitely two of the biggest challenges.
Yeah. It's nice to hear, how you guys think about things differently. And, I'd love to know what your biggest channels are right now, like, within medical, within kind of hybrid, and then within the cosmetic and aesthetic place. Like, if you guys are looking at your foundation and saying either this is what I'm building in my foundation, or my foundation is really strong, what does your foundation look like? Jeannie, and I'll start with you on that one.
In terms of where we are acquiring our patients?
Yes, exactly. Yeah, the foundation for patient acquisition.
Well, I would say, I mean, if we could look at Google Analytics, which we can't anymore, but it's always been organic traffic. So making sure we're converting that organic traffic. SEM is important because it gets you, it's more bottom of the funnel. So we absolutely use that. We take more of an omni-channel approach with medical, and that's in areas where we're not booked out, because it doesn't make sense to market if you can't get patients scheduled for 4 months. But so we're using in areas where we've had a huge growth in the last 23 months, we've added 23 locations. So
wow.
that's, and a lot of those are in rural areas. So marketing strategies are different there. It's like Google hasn't gotten there yet. So, there's not search impression to do SEM. Facebook works really well there. Some of the traditional channels, even like print, these patients will bring in the newspaper article with the physician on it. So, but I would say that we focus a lot on, patient journey of how they find a dermatologist is often through skin conditions and symptoms. And so we might show up on a blog or our service page. We also do use display advertising. We can do retargeting because we have the CDP for patients that may have come to our site but not converted. So definitely doing all things digital advertising, but we have not lost sight of the importance of organic and SEO. But email works really well for us. We've had Salesforce Marketing Cloud for, I think, probably about 4 years. And the more we're able to cross-sell and target, because it is connected to our data warehouse. So some of the journeys we're able to do are based on when a patient was last seen, or their last service that they had.
Yeah, I love that. We see a lot more. I think there was a panel this morning on kind of how to use like last visit data, EHR data, diagnosis code data, to reactivate lapsed patients, or to help them pull them through that journey, remind them when they need to be seen. So I think it's great. You guys are far in that journey. I also love that you didn't give me a one size fits all answer. Like there's different strategies for rural versus urban markets for based on capacity. Where are we, de novo? There is, the mix you may use the same tools, but the mix of them may be very different on a case by case basis. So that's great. You guys are definitely in the sophisticated end of really starting to use data. Ashley, I know you guys still consider yourself a startup, but you're growing really fast. What does your foundation look like for patient acquisition?
I think it's very similar to kind of what's been shared. It's much more of a regional approach because we have your downtown Chicago locations, and then we have your rural central Illinois locations, which one size does not fit all. To probably add to that, referral outreach is a huge component of our marketing activities in the market, with a physician liaison, literally going door to door every single day, touching, making contact with those providers that are currently referring, and then following up with ones where there's opportunity to increase referrals. And it's that closed loop location too, or communication, that we focus on too with our physicians and our staff back to those referring providers to make sure that they're closing that loop of care provided to that patient. We also do a lot of email marketing. I feel like we've been implementing Marketo for 2 years now. I think it's only been a year. But using Marketo for a lot of our email outreach, very similar to what you were saying with diagnosis code, last visit data. And then specifically on the cosmetic side, from kind of that selling approach to if you had Botox, you may be interested in, or your Botox appointment is lapsed, it's time to reschedule. Just making sure that we're staying at the forefront of all patients as they are continuing to make choices for their care.
Yeah. And Stacy, I'd love to hear from you too. I know you're also in the building side of things, but unlike this, maybe need-based, I have condition, I need care. You're sitting very much in the elective side of this vertical. So tell us a little bit about what drives business for you.
Yeah, we just recently completed a patient survey across all of our practices and really learned where they're finding us from, and a majority of them are from friend or referral. But obviously, new patient acquisition is really important to us as well. So SEM, paid search, paid social are two really big components of our marketing channel. We also do rely on a lot of lead nurturing through email, text reminders as well. We want to make sure that our websites and our online properties are as educational as possible. And that's one area of improvement that we're working on now. Is we've partnered with a website firm to update all of our sites and really improve our organic traffic. As I think Ashley mentioned, organic traffic is a huge driver for most of us, for really qualified patients. And so we've seen that as an area of improvement for us. In the meantime, we do rely quite a bit on paid search and social for new patients. But as you mentioned, in different markets, it's different. For instance, we have a location in Gulf Shores, Alabama, that TV does really well, a local TV channel. In Atlanta area, radio does really well. In other areas, there's some print campaigns that tend to really drive some new patients as well. So it does vary quite a bit. And then in South Florida, user-generated content and influencers are also becoming more of a strategy for us as well. Women love to show off their bodies in South Florida, and they're really happy with the results. So that's been a really great way for us to just spread the word and more on a more organic level.
Yeah, I think the social element is, there's certain verticals within healthcare, I see it more prevalent than others, and this is definitely one of them. I think the key to a successful social strategy is having the right content and the right things to say, and an authentic brand voice. I'd love to get everybody's opinion. And Stacy, I think I'm gonna put this one right back on you. What, you've got, user-generated content in South Florida, but you've also got this centralized marketing function, and you're trying to build scalable solutions. What are some of the things you're putting in place to help your brands manage organic or paid social at scale?
Yeah, so we're we're sort of reinforcing our team. We're hiring for social media. We've got an employee that has just recently helped, has just joined us and is helping with our social strategy. But then partnering locally with content creators, whether that's someone within the office that's there quite a bit, or someone that can go in and film that content on a regular basis with the providers. Video is a huge component of our social strategy. So we need to make sure that that's really timely, updated, and relevant for our audiences. So supporting them by making sure that we have the right strategy in place at the corporate level, and then supporting them from a freelance or from a like a contract position for those organic content creators. But a lot of the practices actually like to create that content. So there might be a front desk person or someone in the back that really likes to film content or to get photos and has some great ideas. So we also leverage the team members that are existing to make sure that we're getting a more local, regional kind of a feel than just more of a standard corporate feeling. Because as I mentioned, what happens and what works well in Florida doesn't always work well in Virginia or in Alabama. So we've got to tailor our approach to the market.
And Stacey, just while I have you, what social channels are you using? What's most effective in the cosmetic space?
It's a mix of Instagram, Facebook, TikTok, but Instagram is typically the best channel for us because it's really visual, and that's really what our audience loves. They love to see the before and after images, as well as see provider videos as well. And then TikTok's becoming a growing channel. There's just a lot more competition on TikTok, a lot more regulations as well. So just trying to be cautious and not approaching too many channels at the same time.
Yeah, I think that's a great point. Kind of not spreading yourself so thin that maybe you're not doing a certain channel justice or creating a negative impact. So that's really smart. Jeannie and Ashley, on the medical side, I mean, you said it, Ashley, to begin with, there is an education piece that you can self-refer into derm, that these, what annual skin checks can and should be doing. Are you guys using social channels to tell those stories, and what formats are you finding are best?
We mainly stick to Facebook and blogs for all things medical, leaving it completely off of Instagram or TikTok, just because, like as Stacey was saying, it's just not the glamorous thing that people are really looking for on Instagram. But again, lots of education. I think to add on to what Stacey said too, you mentioned having local involvement, and that is key because you really can't mass produce content and make it specific to each region. So having our providers involved, even if it is talking about gender and conditions, have been the best performing posts that we've ever had. Patients want to know, they want to see, they want to create connections and relationships with those providers. So having them create their content, even if we're providing them the scripts and we're recording it, posting it for them, but just getting their buy-in has been the biggest piece from the gender side and cosmetic as well.
Yeah. Jeannie, any social strategies you'd like to share?
Yeah, I would agree with Ashley. So we use Sprout Social now for posts. We have an internal team of just 2 with over 100 locations, but Instagram it needs to be very local. So you can't really achieve that through static posts that are, images. Videos, what does the best. So we try to get local teams, like Stacey was saying, if we can find either contractors or smaller agency to help with that, or if, again, it's the younger staff that really enjoys those channels and they want to be involved with it. It's actually sometimes, in some ways, we have some of our younger physicians. We do a little bit of TikTok, but it's more on for e-commerce. But where we have had staff do fun TikToks with their physician, and I think it's kind of a fun way to present, a physician to, as long as it's done tastefully, which it is, as someone that's approachable. And I know, oftentimes patients convert that way. TikTok is harder to measure, I think, unless you're trying to actually sell something. And you're on TikTok shop or something. So we've not really invested too much time in that. So on the aesthetic cosmetic side, We do have several plastic surgeons. We use Instagram more as a channel. But we've dabbled a little bit on the influencer side, but for the most part, we've just stayed on the organic posts and before and afters and videos of people getting procedures. We also, we do have a YouTube channel. So, you know, a lot of times some of the things that you film on YouTube or Instagram can be repurposed on your websites, embedded into emails, because a lot of people that are wanting to do certain procedures, whether it's medical or cosmetic, they want to see it, not necessarily just read about it. So that's where that's really helpful. And I don't think the videos have to be overproduced. It can just be done from your iPhone.
Yeah, that's a great tip. That's such a barrier video sometimes. And we're all on our phones nowadays. So that is an absolutely acceptable, you know, capture method. Ashley, I think you wanted to add something.
Yeah, I was just going to say too, even leveraging other tools. AI has been a big one for our team. It made me think of it when Jeannie said that she has 2 people, same here. And like to create all of this content or idea generation, giving kind of those scripts and prompts to teams has been a huge opportunity for us to be able to get more out and do it more efficiently. And then integrating those tools and giving kind of the resources back to the local teams. Our teams all use Canva, which we have created entire brain templates, brain sets, everything is already in there for them, created with scripts, with ideas, and they're able to just kind of plug things in and then send it to us for review and post as well. So just using those tools have been a big opportunity for us this year.
Yeah, when you're 2 people, you've got to build a scalable function or you will, you know, analysis
Drown quickly.
Yes, yes, exactly. And I did want to ask, I think it's always a question people have, you know, what is the makeup of your team and what resources do you think are best kept kind of in-house, kind of closer to the vest, and what, you know, to what degree do you guys leverage external partners? And Ashley, I think you kind of answered it. And Jeannie, you said too as well, like what are the functions of the members of your team?
On our team, we have a director of digital, director of marketing. She does, excuse me, more the back end WordPress editing, and helps with the emails, cosmetic specialists. And we have someone who's over content and reputation management, social media, kind of more of a project manager with all of our onboarding of our new locations and positions. I have 2 recruiters, and then I have a couple of people that go out and do outside sales. And in terms of agency versus internal, we've kind of gone both directions where we've had agency, and sometimes the problem with agency from my standpoint is nobody's going to be as passionate about your KPIs as you are. So sometimes it's hard to find the right partner from that standpoint. But I mean, anything that's web development, we are able to do some things on our website, but the way I like to think about it is if we're painting or redecorating, that we do it internally. If we're moving walls or adding stories on our house, then we use web development.
I like that. That's going to be my new analogy. You'll hear that everywhere I go from now on. That's great. I think that's a good way to think about it. There's, you know, how do I best utilize the teams that I have? And then what is either like super technical, super skilled, or maybe we just don't have the capacity right now, and bringing someone in to do it is more burdensome than finding an agency. And Stacy, your team structure and kind of the things you like to keep in-house.
Yeah, I've only been with the organization for 7 months now. So we're building out the team, just recently added 2 new additions. I think hopefully one is on this call. She's our director of brand and communications. So overseeing content creation, SEO, PR, and really thought leadership strategy. So that's been immensely helpful. And we added a social media person as well. And we continue to build out the team and leverage agency relationships. For instance, we use Cardinal for our paid search and social. We utilize another agency for web and SEO. And then we have brought in-house a lot of the social component because, you know, as Jeannie mentioned, there's no one that's going to be as passionate about your brand as your own team. So we've recognized that. We've made some mistakes along the way. Obviously, we did did originally outsource social media because we just didn't have the bandwidth, and really recognized it just wasn't hitting the mark. And so bringing that in-house has allowed us to really focus on what posts are performing well, and what our audience really likes. So we've been able to make some adjustments there. I did see a note from someone about what KPIs are we really leveraging, and what are we looking at from a social perspective. For us, it's still gonna, it's always about engagement and impressions, but the most important piece of that as well is scheduling appointments. So we allow, some of our practices have the ability to schedule online. So making appointments is the top priority from a KPI perspective, but continuing to see engagement on our posts, that's more of a social metric that we're utilizing as well. And getting providers engaged on how to create content. It's really showing them the research behind, here's the doctors that are doing it really well, and this is what it's leading them to. For instance, I just spoke with a doctor earlier this week that is usually using Instagram solely for his lead generation and patient acquisition, and has a fuller schedule than he did even last year, which is pretty remarkable. And that's because he's always engaging with his social team, creating content almost daily, and then also reaching out to people within his network. So it's not just about putting the content out there, it's about commenting on other people's posts, engaging with people that are in kind of a similar field. And so if you understand your market really well, you can target those folks online in a more one-to-one kind of a relationship. Networking has really changed in the last 10 to 15 years with social media. So it's not just about going to an event or interacting with people in person. You can also interact with them on social media too. So that's the other important piece of this, is engagement from not just the social media team, but also from, even if it looks like it's from the providers, someone sort of managing and outreaching that way.
Yeah, and we got a great question. This has come up a lot over the past 2 days. People using terms like marketing ops, MOPS. I've heard it all, but this need, as we grow, to collaborate a lot more with our operational teams, and I think the providers in provider-led groups like the three of yours are critical. Stacy, you mentioned one provider who's super engaged, but how are you guys navigating, whether it's I need to extract information from them because they are the expert, or I need their participation in certain marketing initiatives? And Jeanne, I'll start with you. Like, to what degree are you or your team interacting with the providers on a regular basis?
I'm interacting with them on a daily basis. So really kind of helping, I need to understand what's their special area of interest, what type of patients do they want to see. I work frequently with them on blog content. So we look for trending blog topics. We have a medical writer, but we never publish anything unless it's been reviewed first by a physician, because we don't want to put any misinformation out there. And then I also pick on our new physicians who are trying to grow volume from a media standpoint. So we work with them to try to get them, in online publications if they're brave enough to be on TV or radio. So, but I think it is really important to connect with the physicians. I learn a lot from them. I just learned something just today about, one of our physician salespeople who went out had a question about referrals and if we accept certain type of patient, and it kind of spurred me to have a new idea for a blog and maybe a media pitch. So I think if you're not in contact with your physicians, then you're missing out on, because they're the ones who are hearing about all the weird things that patients are asking about, what's trending, and then also what they're struggling with.
Yeah, I think that's, when you think about content, if you're going to address their fears, address their barriers or concerns, like, you have to know what they are first. So you've got to extract that information. Ashley, any additional thoughts on how the providers participate in marketing at VitalSkin?
No, very similar. It has to be a key involvement. We do also quarterly business reviews with all the physicians, both from the operations side and the marketing. where we do look forward to the next quarter, and similar to what Jeannie was saying, on identifying what service lines do they want to grow, where do they feel they're struggling, and cover all things from the first time that the patient initiates to schedule all the way to checkout process and review and reputation management. So try to create as much transparency as possible so that they have engagement and buy-in. I feel like knowledge is power to them sometimes, especially on the marketing side. Maybe they don't necessarily know what we've been working on or what we could provide them. So just involving them in every step of the way when they want to be involved, or encouraging them to be involved is usually our approach as well.
Yeah. And we got a question in the chat. Stacy, someone asked if you could share any examples that you have of creating customer loyalty. And I think specifically in like the cosmetic and aesthetic space, as Ashley mentioned, there are these options on every corner. How are you guys getting people to be loyal to your brand so that they are constantly coming back?
Yeah, I mean, there's certain ways that we can incentivize patients that we just have to be careful that we're within compliance, but offering them a discount off of future services is certainly helpful. But I will say that the best sort of like the best testimony we can get is when a patient's really happy with the results, they will tell as many people as possible. So that's been an easy way to kind of I guess influence some loyalty there, but also memberships have been helpful for certain med spa type related services, memberships, and then other referral based incentives. So whether it's a percentage off your next procedure, or a certain dollar amount off of your treatment for referring a patient within a certain guideline, we can certainly offer that.
And you mentioned reputation and reviews. Are you using any tools that you would recommend to generate reviews?
Yeah, we've got a tool that's integrated with our practice management system that allows us to send out a review almost immediately after an appointment or a service. So that's been immensely helpful. It's called Next Patient. You may be familiar with it. And some of our practices are using some other various tools like Weave and other things like that. So we are working on getting everybody kind of on a more consistent platform, but there's multiple tools that are used for review management. But we do find that if we get that review pretty quickly after their appointment, they'll remember and more likely to, leave a positive comment.
Yeah, I think it's something like within 30 minutes, and SMS is usually the most effective over email, just because everyone's on their phone. You see it as you're walking out to your car. It's a great way to capture them before they've mentally moved on to the next thing. Jeannie and Ashley, are you guys using any technologies you would recommend to help with some of these things?
Our review process is kind of two-stepped. We actually use Qualtrics for patient satisfaction surveys too. So implemented that a couple of years ago. We were using the integrated EHR solution, but had to kind of pause that to get the Qualtrics patient sat surveys in ahead of that. Since then, started sending a review request after the patient sat survey. Our response rate is still really low though. So probably a word of caution if it's double surveying basically, right? So the patients are receiving 2 requests. I already filled out 1. Why do I need the second? So we're kind of working through that right now. We had seen really great review generation without Qualtrics. So now trying to kind of find a workaround for that going forward.
I've seen groups do it. I'm curious if anybody else is more of like a percentage of the population split between the two, because I know exactly that. Yeah, that's a tough challenge.
Yeah.
Jeannie, any words of advice on that front?
Yes, for reputation management and reviews, we use Bird Eye, and we've used them for a while, and we've integrated that into our Google My Business listings, and there's an API on the website, so it auto-populates and refreshes. And I'm constantly amazed with the reviews that we get. And it is user-generated content, and it makes me proud to be a part of our organization and the care that we provide to those patients. And I do think that makes a difference because when patients are trying to make a decision on where they're going to go, they look at reviews. And it's not just that, and Ashley would probably say the same thing. When you're recruiting physicians or providers, they look at those reviews and they look to see, how you treat patients and what your reputation is in the community. So it's really important. I remember when we first started it, I had a lot of physicians that were freaking out. Because if you can only imagine being a physician and you Google yourself, you could live and die by what people are saying about you. But it's the happy people that go on their day and don't leave reviews. It's the people that are not happy with the world that will bring you down. So
that we're going to do it.
yeah. And then for getting patients to come back, we on the medical side, and we actually do this for cosmetic too, we have recalls in place. So if a patient comes in and they're supposed to, especially if like it's a skin cancer patient, supposed to come back at a certain date, we are interconnected through Salesforce, so we can see from the data warehouse that if a patient had a recall and it doesn't see a future date, then that starts a journey to try to get those patients back in. And that's been really successful, both on the medical and the cosmetic side. If you want to maintain fine line or smooth skin, then the best wrinkles are the ones that don't come back. So you have to keep getting Botox. So just reminding them of that.
Yeah, it's interesting. Cardinal had a big initiative this year. We've historically been a new patient acquisition agency. We really wanted to extend our ability to work with our partners throughout more of a patient life cycle. And that very much included recall, win back, reactivation, whatever terminology your organization uses. And we did a number of, demos with various tools and technologies, and Derm was always the case study that they use because there's just so much you can do to be part of that patient's, health journey. Like you said, skin is the biggest organ and so many things come through it. And you have that initial skin check and there's so many notes and things that you find or see or things that you want to keep an eye on. And you have to really proactively keep the patient aware of when they should be coming, what they may need to be concerned about, that you want to check them again when that is. So it's interesting that I think Derm is probably a vertical very ripe for, proactive and aggressive reactivation. I love that you guys are already doing it. And Ashley, are you guys doing anything on that front?
Yeah, similar through EHR and recalls, and then also integrates with Marketo from an automation standpoint based off of last visit or diagnosis.
Ashley, you said you've been implementing Marketo for quite some time. How has the experience been? I'm just curious. We're looking for a new email marketing platform too.
It's been, as with all tech, it's always more than you expect, always more than they scope. Even if you have really diligent use cases. Honestly, our biggest hangup is our EHR. They say that they have an open API, but really it's not. So now we're having to build more stuff out of our data warehouse and do automation.
Can I ask what is your?
Yeah, I was going to ask the same.
We have ModMed.
ModMed. Oh, okay, yeah, we have one practice on ModMed as well that will be changing soon.
Physicians love it. It's just not a marketer.
It's great for derm, is what I've heard. Yeah, not great for plastic surgery.
They use ModMed for practice management and for EHR.
Mm-hmm.
Okay.
Yeah,
it's interesting. You always we get asked a lot to talk or give advice on tech stack, and my answer always is, what is the fixed element that we cannot move? Like, what's the immovable, the ModMed, and then. Okay, my answer is then going to adapt based on, what's the best scenario based off of the thing that you cannot change.
Yeah, you don't realize how much that sort of handcuffs you over time if you don't have the right EHR that integrates with other systems. I mean, for us to really see full funnel attribution, we've got to see that data that comes from patient appointment completed and revenue. And if we're not able to pull that out and push that back into our ad platforms, makes it really challenging.
Absolutely.
Really tough. And Stacy, we are here to talk about multi-site, multi-brand groups and the MSA structure. You just alluded to it. You have a lot of brands and they're on different EHRs. So talk to me about, you guys do an M&A, you acquire a group, they partner with you. Like, what does that look like? What are you keeping localized? What are you trying to, scale and make efficient and bring everybody on board something similar?
Yeah, I mean, the purpose of our platform is really to make things easier at the practice level, but obviously that takes time. And there is a little bit of pain in the beginning so that we can centralize some of those functions. And one of those is the EHR and the tech stack. What we're trying to do is sort of level set all of our practices so they have the right Wi-Fi coverage, which is sort of a basic thing you would think that is, already existing, but even just bringing them up to speed, literally on Wi-Fi and making sure they have fiber, and then looking at the right platforms that will help make their lives easier. Some of them were on a practice management system that was on-premise server, so we're looking to move them over into the cloud. So really bringing up everyone to the same practice management system, the same lead management system as well, and putting processes in place that will help to streamline some of the work that they've been doing. We're really taking them from being a small business to more of a medium, larger size business with a lot of opportunity. And so there's a little bit of growing pains in that in the beginning, because people want to do things the way they've always done them. So it's just working with the practices and making sure that we're there to hear their feedback, not just force something down their throat that they may not want to do, but truly getting the feedback from the entire team and staff and looking ahead to where we want to go, not just where we've been. But when it comes to which platforms do we want to put in place, we always get the feedback from the team first, and do demos and get the right people on the right calls.
Yeah. It's, you've got this battle of, there's more buying power, more consistency when you can get everybody on the same tool, but you realize you don't want to do more harm than good. So you kind of have to balance those two things.
Mm-hmm.
Ashley, you guys have an interesting hybrid of how you kind of think about it when you guys bring on a new brand or open a new location. Talk the group through that, because I know you have VitalSkin as kind of both a patient-facing entity and it's the MSO, which is sometimes a unique take on things.
Yeah, so typically if we open a location ourselves from a scratch start, it will be a VitalSkin location. All of our other acquisitions are usually driven based off of if it's a new location in the market, how strong their brand reputation is, and just longevity of it as well, and what our other growth plans are in that area. So we do have quite a few brands across the 4 states that we're in. But similar to Stacy, we start with infrastructure, move to EHR within kind of that 6 to 7 month window, and then really start to evaluate what other systems to start implementing with the locations. All of our acquisitions and scratch starts or de novos are all provider led. So those are all conversations again with those providers to ensure that what we're doing is adding value and enhancing the practice and kind of bringing them to that next level as they continue to grow with under the VitalSkin name.
Yeah. And Jeannie, you guys are 23 de novos in 23 months, right? So everything is opening up under a single brand. So you've kind of got a little bit more, you have a playbook, right? And you're going out and saying, this is what I know. What changes with each de novo from that playbook, or what are some of the things that could change based on circumstance?
Some of them are full locations where it's 5 days a week. Sometimes it might be initially a shared location. So that's a little bit different on the marketing side. But from kind of going back to listening to Stacy and Ashley, so until about 5 years ago, we were in a strong acquisition mode, and kind of had this similar of what you guys had, where everybody might have been on different tax ID numbers, and some people, they were on different instances of different practice management, EMR, and our new CEO who came in 5 years ago kind of put a break on, we're going to integrate all the practices on the same platform and love on the ones we have, and then, optimize everything before we do any more acquisitions. So that, I think that's been a good plan for a lot of reasons. Physicians like to get paid properly, and through doing that, it helps us leverage like managed care reimbursement. Clinical quality and compliance is very important to us internally. We want to make sure that everybody is, below the number of stages of Mohs and excisions and all that stuff. And then also, I think just generally speaking, we're able to, as a team, support them better if everybody's on the same platform. We do have some brands who have not, we've kind of opportunistically, as time's gone on, when we've had Signage changes, we've changed signage. Patients get the patient bill that they get is from US Dermatology Partners. The emails they get is from US Dermatology Partners. So it's actually better for us to completely rebrand. But we do have several practices, including some of our plastic surgeons who have their own individual brand. So we just make it work.
Yeah. Yeah. No one size fits all. I think before we get into, closing statements and thoughts and picking your brain on where you're going in 2024, I would love to ask everyone's brand USPs. I think differentiation in the market, Alex and I talked a lot about this yesterday. The basics, like we take insurance or we're convenient in our location placement, are kind of table stakes in healthcare now. And it really requires you to dig deeper into who you are and why you're different or better than the other option. I would love to go around and hear how you guys see your brand as being different, and maybe if you have any tips or advice on how you came to that, because this is something a lot of groups struggle with, is really extracting the unique USPs. Ashley, I'll start with you.
I think I mentioned it earlier, but just with practices being provider driven, that's also the patient side too. Any patient is always seeing a nurse practitioner or a physician. And even when they see a nurse practitioner, that care has oversight directly from the physician. So any communications, it is always from the voice of the physician of that practice, to ensure kind of that quality piece that we want them to understand from their care. And then a lot of our locations too are gen derm and cosmetic. So if a patient's coming in for gen derm, we're not just educating them on gen derm, we're making sure that we holistically discuss their care, their treatment plans with them. And sometimes that evolves into cosmetics too. So if we get them from even a primary care referral, oftentimes we're seeing that they're converting to the cosmetic side too, because the physician or the nurse practitioner has made that relationship, gained the trust with the patient, and kind of converted them to that lifetime patient within our practice.
Yeah, awesome. And I'm sure what lends itself very well to that USP is probably some of the storytelling that you're able to do. You get patient testimonials, the stories. I mean, you want to show that, instead of just telling it too. So yeah, that's great. Jeannie, how are you guys differentiating?
I think both to consumers or patients, and then also to physicians if we're trying to recruit. We're physician led. So we do have 8 regions and 8 physician region presidents. And so there's a very clear delineation between operations and medical, and nobody crosses that. And I think that really helps with our clinical quality. But then on our values are SOAR, so service excellence, one team. One team I think is really important, because we expect our everyone to be treated with kindness and embraced within the organization. So our physicians, if they want to be fully staffed, they have to really embrace their staff. That's kind of an issue right now. And then accountability and reliability. So we try to live that, within, and be responsible and respectful of the physicians. But at the same time, we're all working together for the same cause.
Yeah. Awesome. And Stacy, how are you guys? I know you got multiple brands, as most of you do, but any kind of common themes or things that as an MSO you guys are bringing to the table that maybe weren't there before?
Yeah, I think from the MSO perspective, it's really helping to centralize and remove some of the burden that's already on their plates. And so making their lives easier, and also helping them to achieve the growth that they've been looking for, while maintaining a lasting legacy. We're not stripping out their brand and changing their name. That's really part of our entire proposition, as well as you get to maintain your brand and your legacy, and we help you grow and create a succession strategy there. But from the patient side, it's truly having board certified surgeons that are qualified to do these procedures, and not just med spas that aren't overseen by a doctor. These days, just about anybody, as Ashley mentioned, can start a med spa, but ours aren't just a doctor that might be 3 states away that sometimes visits. It's truly someone that is in the practice on a daily basis. So if anything ever potentially could go wrong, or you need advice on other treatments, there's always a board certified plastic surgeon there to help oversee that service. And so the treatment level is truly top notch and elite. And the level of service we're providing is like concierge, personalized level of service for each patient that comes in. So aesthetics is a little unique in that way. It's obviously elective care, so people expect and want to have the best possible service.
Yeah,
That's what we're
absolutely.
delivering. Yeah.
Yeah, I love it. It's great that you guys even, as marketers, like had that answer handy. I didn't tell you to come prepared with that. I think it's important though, as people representing the brand, to be able to say that definite USP on the spot. So I appreciate you guys doing that exercise with me. We've got 5 minutes left, and I want to leave everybody listening with ideas if they're not fully planned out for next year on where they should be focusing their time and energy. So I'm going to go around and ask each of you what your biggest focus is. And I've also been asking, kind of as we go through these, any learnings that you would, or cautionary tales that you would say, something you tried, tested, and it didn't work, that you maybe want to save someone else the time of going through. So if you have thoughts in either of those areas, I'd love for you to give them to the group. And Stacy, we'll start with you.
I think like a cautionary tale I would give is don't assume that one channel or another may not work. For instance, you may sort of eliminate print or direct mail, when that might be a really great option for a market that you're serving. So consider all options. As far as other opportunities that we're looking for and really focusing on this year is lead nurturing and patient nurturing, like throughout the journey, is making sure that we are staying in front of our patients for retention and loyalty purposes. So looking at some other opportunities to add to that part of our journey for our patients. So we're investing in some technology there as well.
Awesome. Ashley?
I referenced it earlier, but Marketo would definitely be one of them. Not necessarily Marketo as a company. I think it's just making sure that you are fully aware of the integrations available specifically with your EHR, which is truly the one thing that you cannot change usually within your organization. So make sure you do your diligence there. Make sure that you investigate on your own, I would say, versus allowing a partner or a third-party partner to actually, speak to that vendor and ask the questions on your behalf. That's probably one thing that we would have done differently. And then as far as areas of focus, we hired 2 new regional marketing representatives that will actually be living and working in markets versus kind of the centralized approach that we had used for the past couple of years. Excited for them to work more on that social and organic content with our providers and build relationships with the teams, so that they can really be a champion and tell stories on their behalf and be that partner in idea generation for them. Also a big focus on growing our referral network within each of the locations, which is really just feet on the street, and then getting Marketo to the finish line for this year.
Which there may never be a true finish line, Ashley.
May
You
not.
get as close as you, and then you're just,
It's useful maybe this year would be good.
There you go. Get it working well. And then Jeannie, I'll let you close us out with your focus for next year and anything you'd caution us against.
Yeah, so our focus for next year will be continuing to roll out all of the Salesforce that we brought on. So trying to build out those journeys, the customizations, and use that for cross-selling, increase retention rate. And then also patient experience, so pre and post education, emails and content to help patients that might have questions. And it would also hopefully reduce the calls to the call center. The other thing that we are very focused on is referral development. So we started that, kind of had reinitiated that this year, but we'll continue to do that in 2024. And then finally, I guess the caution that I would say is, I know a lot of people are working toward potentially doing CDPs. And I think from my perspective, I think I wish we would have planned it out a little bit more. I think we would have been able to leverage it more quickly. So it's not enough just to have an implementation partner. You really have to, get in the weeds right alongside them in order to implement it and to get the most out of what you purchased.
Awesome. Thank you guys so much for joining. I cannot thank you enough for your expertise, your time, your energy here, all of the wonderful insights. It's been great having you. For all of our listeners, head on back to the lobby. We've got just one more session today, and then we're going to have a big Q&A session at the end. So that's for all questions that came up throughout the panels or the presentations that we didn't get to. So feel free to hop in there if you have any specific questions you want to ask our experts. But otherwise, you guys have a great afternoon.
Thank you.
Thanks.
Thank you.
Nice to meet Ashley and Jeannie.
Bye.
You too.
Nice
Bye-bye.
to meet you.